Hi, I'm Emma Dean, one of the nurse specialists from the Complex Care Dementia and Liaison Psychiatry team.
And I'm Jodie Lay, Clinical Lead for Complex Care and Dementia Liaison. Our service supports RCHT, acute hospital and also the community hospitals, and we specialise in dementia and delirium, which is why we're speaking to you today.
So there's a high risk of falls in people with cognitive impairment, just so that we can distinguish between the risk factors. So somebody with dementia may be at risk because of a multiple sort of risk factors, such as medications, where their state of cognition is, where they are on that road, and how much supervision they require, whether they're independent or not dependent. And then we're also looking at what increases that risk, from supervision with prompts to the heightened increase of risks regarding delirium.
So quite often our patient group will have perceptual difficulties, so they might quite often bump into things, or they might, especially if someone is experiencing a delirium, they might make very fast and quick moves. I think on the ward it would be quite helpful to engage these type of patients in meaningful activities, because obviously they're not walking around so much, they're not into preventing risks. One of the things you could do is use the This Is Me. So the This Is Me is published by the Alzheimer's Society. You should have that on your ward, and it should be kept at the end of the bed space, so you can look at the patient as an individual, thinking about what their likes and dislikes are and what you can engage them in, and this will help you to tailor the meaningful activities. Quite often this group of patients may be on enhanced care, or they may be in a bay where there's an HCA supporting them. It's really good to use this member of staff to start thinking about that patient as an individual and engaging them in meaningful activities.
Some of the aspects of somebody who's experiencing a delirium, so that can involve an acute onset, a fluctuating course, so they can sometimes be lucid and have some understanding of their environment, and then very suddenly change, so that they're extremely confused, possibly restless and agitated, and not aware of the risks in their environment or to themselves or to other people. And that's at the time where you might need to think about moving up from the therapeutic interventions into a pharmacological risk assessment, both looking at the medications they're already on and whether those are already impacting on a falls risk, or whether the confusion level is so high and the distractibility of the delirium means that they're at such a high risk of falls that actually some medication might actually help to reduce that risk.
It's also about going back to basics, so looking at that patient, their bowels, their fluid, their sleep, and quite often our patients will be disruptive if they haven't had sleep or they haven't had their bowels open. So really ensuring that those things are supported. So you might want to start a food and fluid chart to make sure, especially if somebody is experiencing a delirium, that they're having enough fluids, because obviously their delirium won't resolve. So it's looking at the person and thinking about your basic nursing needs.